Hi, my name is Haruko Tanaka, and welcome to my TED Talk. Today, I want to talk about maternal mortality and what that means. But before we get into that, how many of you are a C section baby? Well, if you are, then you are one of 31% of all live births that are C sections in the United States. If you were born in a country like the Netherlands, you'd fall within 15% of all live births. If you were born in Mexico, you'd fall within 55% of all births. So humans are all biologically the same, right? We're all Homo sapiens. So then why do rates of C-sections differ so much from where we live? Why is there a greater need of C-sections in one geographic location than the other? We'll come back to this question in a bit. Now, related to C-sections is maternal mortality. Now, I am not saying C-sections lead to maternal death because it doesn't at all. C-sections are a life-saving procedure when performed at appropriate times. The CDC actually says that the C-section rate should hover around 10 to 15%, but anything over that is actually not proven to reduce mortality. Which means, why are mothers undergoing surgical procedures when they don't really need to necessarily? So it was also found that maternal mortality rates were high when maximum surgical interference in normal or potentially normal labors was advocated by a physician. Another study found that C-sections was 7 times more hazardous than vaginal births. So maternal mortality, as the CDC defines it, is the death of a mother during pregnancy, delivery, or shortly after delivery from pregnancy complications. And it's usually expressed every 100,000 live births. So when we compare the 3 countries that we mentioned before, the US has a maternal mortality rate of 23 deaths out of 100,000, the Netherlands with 5 deaths, and Mexico with 33 deaths out of 100,000. So again, we ask the same question. We're all Homo sapiens, but why is there a greater mortality rate in mothers just based off of the country that you live? Well, it turns out it's actually a lot more than just where you live. It's the culture, the politics, the economics, social status, your lived experience, your ancestors' lived experience, and every large structure that you think won't affect your health, but it does. So I'm a medical anthropology major, and I'm about to graduate in May. So this is what I've been learning the past 4 years of my life. Medical anthropology is the study of people, cultures, and larger structures such as politics, economics, ecology, the environment, and how that affects human health, diseases, and the well-being of humans. So I'd say this is pretty much my alley. So one concept that I like to talk about is the medicalization of birth. Now, what does that mean? Medicalization refers to when you take a natural bodily process and pathologize it and treating it as an illness. People have been giving birth since the beginning of time. So why are we treating it like it's some sort of medical disease that requires hundreds and thousands of dollars of hospitalization? Well, to counter that statement, technological advances are, incredible. By one way or another, you or your loved one has been saved by some sort of medical advancement, and we all might be dead without it. But sometimes medicalization can hurt us, because sometimes you may not need it. This is one example. If you are in the healthcare field, you may be aware of this drug called Pitocin. It induces labor, so it's this drug that speeds up the labor process for mothers, and it gets the mother an extra oxytocin dosage to get the labor going. But Pitocin will also give you super painful contractions that are very close together, most likely because your body is reacting to that Pitocin. Because of the pain, mothers will need epidurals, which basically numbs the pain from the spinal nerves. But then epidurals will also slow down the labor, which then a slow labor is gonna want more Pitocin. So then this results in this cycle of high dosage of Pitocin, more epidurals, more Pitocin, more epidurals, and then a high dosage of Pitocin can cause the baby to have less oxygen from the longer contractions. Then the babies are stressed. Because the baby's vital stats might not look too good, The doctor will then recommend a C-section, and then the C-section will be deemed as the life-saving procedure. But could that C-section have been prevented if we didn't use the technological interventions to begin with? Of course, that's an extreme case, and it's definitely not as simple as I just put it. But now that we have an example of what medicalization of birth looks like, why am I telling you this? I hope that that example did not persuade you to never take a drug prescribed to you by a doctor, because that's not my point. My point is more so that sometimes medicalization of birth can divert the attention away from mother-centered maternal care, like midwifery. This is because medicalization of birth is operated around physicians, with the thought that biomedicine, high technological advancement, surgeries, and medication prescription can eliminate issues related to childbirth. The thought is that high technology will save it all, but we know that that alone will not, and it has to be coupled with primary preventative care. Prenatal and frequent afterbirth care is the key, but there's a problem. In countries like the US and Mexico, where healthcare system is fragmented and it's very disorganized, healthcare is hard to come by, and a lot of people don't prioritize preventative healthcare just because it's pretty costly, unless you're one of the few lucky people that have good insurance. But a country like the Netherlands, preventative mother-centered care is literally embedded in their healthcare system. Within the National Health Insurance Program, they have this program called Kramzorg, which is a pre- and post-maternity care system that involves home visits around the 7th or 8th month of pregnancy until around 8 days following delivery. A specialized maternity nurse can help during a home birth, which are very common in the Netherlands, and guide mothers taking care of their baby, monitoring the health of the mother and the baby. You always think home births are super dangerous and almost very hippie-like, but it might not be the case considering Netherlands' very low maternal mortality rate. So let's talk a little bit about midwives, because I think there's also a stigma around them that they're also hippie-like, using voodoo medicine, but that's actually not the case at all. In the United States, there are highly specialized medical professionals, usually with a doctorate in nursing practice, with about 3 to 4 extra years on top of a regular nursing degree to become a nurse midwife. But even with their credibility, midwives are not super common in the United States, with only 4 providers per 1,000 live births, compared to the Netherlands having 25 midwives for every 1,000 live births. One study even found that midwives, compared to obstetricians, had excellent maternal and infant outcomes that surpassed physician-assisted births and greater satisfaction from the mother. So, how do we combat the higher maternal mortality rate globally and in the United States? Well, first, it's notable to say that there is no one simple solution. Because if medical anthropology taught me one thing, it's that each country operates very differently, and you can't try to fix a problem in a country with another country's solution. Each country will have different issues that need to be addressed within their culture-specific context of women's rights. Because at the end of the day, maternal health care is a women's rights issue. So what can you do for the United States? Well, I'm just a college student, so I guess I'm still trying to figure that out. But I guess when you understand health outcomes as something that's a product of a larger problem, rather than their individual fault or from their individual choices, we can start to combat issues from an upstream factor. So for me, my first step is to acquire as much knowledge as I can and start advocating for better autonomy and women's rights in the US and globally. Thank you.